See, this is the tidal volume. This is the pace at which we are all breathing right now. Normal breathing, normal breathing, normal breathing. This is around, what is the volume? This is around 500 ml. Okay, this is around 500 ml. Then there will be sudden increase. Okay, now see, this is the inspiratory reserve volume. The one I am drawing in red. This one is the inspiratory reserve volume. Okay, let me just mark it like this. Means what? That for example, if you want to take a deep breath, there is some reserve volume. So even this much amount of deep breath we can take. Then there will be what? Okay, so they have put a question, what is inspiratory capacity? Simple, it is the combination of inspiratory reserve volume plus tidal volume. Okay, so that together is called as inspiratory reserve capacity. Okay, then if I want to, I'm normally breathing, I breathe out normally, and then I try to completely empty my what? Lungs. That is the expiratory reserve volume. So you do like this. So take a deep breath, you have to remove, and you completely try to remove everything. So that amount of volume is called as expiratory reserve volume. What you got it out. But do you know that after doing all of this, there is somewhat amount of volume still left. That is the residual volume, around 1.2 liter. Okay, so 1 to 1.2 liter amount of volume will be left forever. Otherwise, it will become like this. Your lungs will shrink and completely collapse like this. So reserve volume, residual volume is really very important. It is really very important. Otherwise, lungs may get collapsed. Okay. Then there is the functional residual capacity. That is the FRC. Simple. What is FRC? FRC is expiratory reserve volume plus residual volume. Okay. Simple. Okay. And finally, I will tell you what is the vital capacity. This is we commonly do in patients. We tell the patient to normally breathe. Then I tell the patient completely take a deep breath, keep holding it, and then completely take it out. Okay, so this much amount is called as vital capacity, your VC. Okay, and as I told you, even after I say that completely take out, but 1 liter of volume will be still trapped. That is the residual volume. Okay, that is the residual volume. Okay. So now the vital capacity plus residual volume both together will be called as TLC. That is the total lung capacity. It will be around 6 liters. Okay, it will be around 6 liters. So you study this. This is really very important. Okay.